So I'm Dr. Debra Wickman. I'm in Phoenix, Arizona at Banner University Medicine, and I'm a board certified obstetrician gynecologist for 25 years. But I've niched myself into a very special role because I'm also a certified sexuality counselor and a certified menopause practitioner. And I've tried to look at helping women with sexual concerns from about every angle I can. So I have a wonderful position here as a faculty member at Banner University and University of Arizona College of Medicine. So my little presentation is really all about how to really expand our thinking around sexuality and to convince you that there is no expiration date on sexuality. It's not like it has to stop when we reach a certain age. It's all an individualized, choice and experience. I'm going to share my screen here to get my slides going. Let's see, it's that one.
Yeah, you're right.
Okay. All right. So I have a unique role here as the director of the Department of Female Sexual Medicine. And the thing I like about this role is that, it's really still kind of the wild frontier. We haven't figured it all out yet. There's a lot of room for creativity and thinking outside the box. And there's a lot of research that still needs to be done to try to answer some of these questions. My presentation, my patients are really the women. So my presentation is really geared toward the female perspective. I know I saw a few men on the call, on the Zoom, so that's fine, because if you're partnered with a woman, then it's relevant to you too, because sexuality is a couple's issue, as well as an individualized internal issue. So I try to look at it from both perspectives. So great sex. I often start out my discussions with patients talking about this. What does it mean to you? And I get the most interesting answers in response. Most commonly, women can kind of look a little blank at me and say, I'm not really sure. I was hoping you would tell me. And that's kind of where we're at with it. We want it, but if you're asked to define it, we really don't know what it is. We usually know if we've had it before, and we know if it's been long gone. But there's a lot of vagueness around it, and how to synchronize that with our partners, because this is one reason why communication is so important, because it can mean something to me, but it can also mean something completely different to my partner. And we both need to define this and work toward a cohesive definition as the coupleship continues through life. Just to normalize this with some actual research data, and this is fairly old data now from 2008, but it really rocked the world when it came out, and it still continues. This PRESIDE study was really the first big study to address, how common are sexual concerns, how common are sexual complaints. And what they discovered was, the combination of any of these above is fairly prevalent. Up to 43% of women complain at some point in life that they're bothered by some of these issues. And it's probably more common to have more than one. Rarely does one thing exist in isolation. But then when you break it down by age group, we really see that as we age, especially as we transition into menopause, that number goes way up. And this is the group, the 45 to 64-year-old women, who have the most distress around it. It's also important to note that almost half of them have some concurrent depression going on. So it's really important for me as a provider to be able to try to sort that out and address both things. But does this basic statistic really tell us what we need to know? And I contend that no, it's not just a matter of knowing a statistical number. We really need to know more about what makes women tick, what makes us desire intimacy. And once we know that, we can kind of address how to improve it, how to, get it firing on all cylinders. We know that wellness in any area consists of, needs to have a holistic approach. And this is the same thing with sexual wellness. There's really 5 key components. And when you break this down into, spiritual contentment and connection, we need to have our brains stimulated, intellectual fulfillment. We're not meant to live in isolation. We're socially interactive people. And we need to have emotional resilience where our feelings aren't hurt every moment, but yet we're able to tell what we want, say what we need. And then, of course, we need physical health. I was so fortunate to have a mentor through the experience of sexuality counseling certification, who happened to be a renowned sex therapist and author herself. It was Dr. Gina Ogden, who was from Cambridge, Massachusetts, and she authored many books, and she was really responsible for founding this philosophy, the 4D wheel of sexual experience, based on her PhD work. And then she developed this over the rest of her life, and she passed a couple of years ago, but I had the wonderful experience of having her support and guidance in kind of formulating my own practice and my own views. And so I really base a lot of this on her 4D wheel method. And really it's simple. The main foundation of it means that what women want exists in all of these realms. We have to divide this wheel into the 4 quadrants because we're not all about the physical. I mean, we know from many studies we can increase blood flow to the genital organs by giving a woman a pill of Viagra, for instance. But most of the time, it won't make a difference because it's not just about the physical.
Just put the little that came on
the side. Okay.
one dish.
I wonder if somebody needs to be muted. Anyway, we also need to include emotional aspects, spiritual connection, and the intellect. And the idea is that when all of these issues are flowing freely and balanced, we spiral towards the center of the wheel where these are all in sync. And this is the center of bliss where we all long to be. Most of the time in the human experience, we don't get to stay here for extended periods of time. Something will happen to bounce us out. But the goal is that we understand and we have a pathway back. And that's the goal that I help women within themselves and with their partners, to really find this balance and continually work toward getting back to that center of the wheel where we're aligned on all those levels within ourselves, with our partners, and with life overall. Sexual awareness is really a key component of quality of life. I see this all the time. I mean, I talk about this I have 3 daughters that are in between 18 and 21. When we're young like that, we have so much quality of life and we take it for granted, especially the sexual health part. With all the hormones working well and our bodies working well and athletic, and as we age, it becomes more and more of a intentional process of maintaining that, and it becomes much more work. So all of these elements of sex are connected. And what I define for myself doesn't mean that's how you define it for yourself. It's not a one size fits all. And that's part of the challenge of my job, is figuring out and helping women figure out what fits for them. But our bodies and minds are wired for pleasure. We do have all that in common. Pleasure means different things to different people, and it transcends through various levels, but affects all of our life. I mean, if we're not happy in one area of life, it's going to show up in other areas. So it's important to really tune all that up. Spiritual wellness is that connection we have with another person and within ourselves, as well as our, religious views and our community kind of life overall. It's about finding meaning and worth in your experience. It's unique to your own belief system. And, you know, there's so much written on achieving the flow state. And I've had a real interest in this in helping women and, you know, and in their experience with their partners and how to really achieve flow state and transcendence in your relationship. And, you know, again, everybody has to define that for themselves, but it's really the awareness that we need to look for that. We need to find ways to connect and keep expanding that and stretching that as we go. Some tips I help women with just to increase spiritual awareness. So I try to share some of these, you know, practical things with you. Really deeply communicate. And some of that can be meditating with yourself, meditating or praying with your partner, or, you know, with whatever's meaningful to you. Getting enough sleep, spending time in nature, especially together. Nothing is as soothing as spending time in a beautiful setting. And we have here in Phoenix anyway, now we're in the good time of year to really maximize that. But it helps us really ponder those questions about who are we? Why are we here? What are we doing? What does it mean? And then it's so important to stay positive and have plenty of laughter in your life. We know that, well, going back to the nature thing, there's been a study that 30 minutes walking in nature is the equivalent of a dose of Prozac. So it's much healthier and better for you to take that 30 minutes and get your body moving, get your blood flowing, and be out in nature. And then oxytocin too, it's that bonding neurochemical that your brain produces. And laughter and bonding really helps that be produced more. When we look at more intimate ideas, within a couple, lovemaking can become a spiritual practice. And we need to really become more intentional about this through our day-to-day, because it's easy to get busy, get distracted, and, you know, put that on the back burner. But it helps to, you know, have an intentional session of deep breathing together. Communication is key. It's really more about just sharing that feeling state together. One way to do that is to start with some eye gazing. This has been present, you know, recommended in many of the, you know, Eastern practices for a long time, but this really works well with anybody, any couple. And 15 minutes is a really long time to begin with. It's really awkward when you start, even though you maybe have been a couple for decades, you haven't quite looked at each other like this. But in my experience, I found it to be so effective just to kind of sync your breathing, and you really look like left eye to left eye so that your eyes aren't darting back and forth, being distracted. But, you know, and sitting across from each other with your hand on each other's heart can really be a good grounding experience for starting your day, starting a sexual experience, going, you know, before you go to sleep, kind of just to check in with each other and become in sync. And then expressing more affection and kindness to each other daily always goes a long way. Another component of, you know, quadrant of that wheel is emotional health. We need to be able to access our full range of emotions to be able to have full intimacy with our partners. And in doing that, we have to be able to trust our partners with our feelings, be vulnerable, know that they're not going to intentionally hurt us, but that we'll have honesty. That openness and love between the two is so important. So part of that feeds into that satisfaction with life overall, with your relationship and within yourself. There's some intimacy building tools. There's many around, but one thing that I like to, because being a physician, I tend to start in the physical, and sometimes we put limitations on ourselves in that physical realm. Well, Dr. Gina Ogden, my mentor, and another very renowned researcher, Dr. Beverly Whipple, came up with this tool, this extragenital matrix. And it's you can find it online. I often print some out for couples. But what it is this. It's really a little matrix, a little graph where across the top are all the different kinds of touch. And then on this axis, the vertical axis, is really all the various body parts that aren't the genitals. And so the goal is to take a few sections of this at a time. You know, it's too overwhelming to do it all at once, but to explore with your partner what you like, what you notice when you touch various ways on various parts of the body that aren't the genitals, because there's so many ways to be touched that are able to convey love and affection and expression that feel good too. So it's really good to broaden your tactile sensation, your perspective, and another way of communicating with each other. Moving into another quadrant is the intellectual health. It really is not a reflection of your, level of education or IQ. It's really all about feeling valued, feeling meaningful in life within your circle. You have to perceive yourself as a competent, worthy, challenged human being. And you have to step into experiences that broaden our perspective and challenge us, especially as a couple. We know from research that when you step outside the box and plan an activity together, often something that's kind of competitive, definitely that's something new that you haven't done before, but you pull together and you do it as a couple, that makes relationship scores soar. It makes dopamine, which is that neurochemical in the limbic brain that mediates desire and reward. It makes that stimulate. And so it can really be a couple building, intimate building process to kind of think outside the box and do activities and events that help us learn, help us experience what our partner's opinions are, philosophies are, and know that much about each other, even if you've been together for years. In doing this, we need to make time for conversations. I like to quote this study that if you don't have a TV in your bedroom, you're going to have 50% more sexual interactions as a couple. We often get so distracted with the television. So we need to, it's okay to have the TV there, but make sure to have intentional times where it stays off and you can talk to each other and have that segue into intimate communication. It's important to ask about beliefs. Even though you've known each other for years, try to think of new things to ask about, even silly things. It just kind of gives you a new frame of reference to segue off into new conversations, which then stimulate dopamine. Physical wellness is kind of the area that I live in as the physician. Of course, it's obvious we need to strive for good physical health. As much of a healthy BMI as we can, fitness as we can, controlling our comorbid conditions, our medical issues and lifestyle factors. And then part of what I evaluate are these hormones of desire. As we age, it's more of a struggle because they tend to get depleted, as I'll explain that in a minute or two. But these hormones of desire are really hormones / neurochemicals, because estrogen and testosterone kind of work together as hormones of desire, and then the neurochemicals produced in that limbic part of the brain, dopamine and oxytocin, the reward, desire, bonding, attachment, neurochemicals. These are all really important to try to modulate and nurture. The skin and nerves of our erotic zones of the body need to be sensitive to arousal. And it's interesting that in women, the same part of the brain lights up, whether it's vagina, clitoris, including the nipples, which is different in men. When they did the studies with functional MRIs of the brain and various stimulation, the studies in men didn't light up when their nipple tissue was stimulated, but in women, it's one of those erotic zones that's wired into our erotic part of the brain. We need to have adequate blood flow and perfusion into those erectile tissues of the genital organs, the labia, the clitoris, the vaginal walls. It's not so obvious with women because we don't have, our anatomy is subterranean. It's not really noticeable for us to evaluate. And we know that women physiologically are disconnected from that. I alluded to that a little while ago. When we increase the blood flow to women's genital organs, it doesn't automatically increase our desire. We don't automatically say, my genitals have increased blood flow. Where's my partner? I want to have sex. We don't notice that because we're not conditioned to that association. And so when that does work is when you already have desire, but you're having trouble with blood flow getting into that area. And that's part of what I help diagnose. Then a little dose of some Viagra can be helpful, but it all, has to fit together and be prescribed for the right purpose. We need to know our body and, our own erogenous zones because we're wired a little differently. And that extragenital matrix is one way to do that. And then probably the most important thing I do, and probably most common thing I do, is help resolve sexual pain, because there's no way the body will have desire for something when it knows it's going to hurt. And so there's so many women that they're, as a nurturing partner, continue to have sex with their husband even though they have pain. And they often don't even want to let him know, because it's something in our core nature, as we want to be nurturing. It's our fulfillment of being a woman that we want to provide this. But when it becomes so painful, it's heartbreaking. And finally, women can reach a point where it's like they just can't do it anymore. It hurts so bad. Well, I want to intervene long before it gets to that. So one of my big messages is that sex should not be painful, and there's so many measures we can take to resolve that. And that's just so important to assess. A few physical factors to just point out, at least in the Western society, we're all so concerned about our weight. Well, over half of us are a little overweight. But this is the more startling statistic, is that more than half of women avoid or postpone sex, even when they feel like having it, because they're self-conscious about how they look. You think, I'd love to be with him, but maybe I'll wait till I lose 10 pounds. And we put ourselves on hold needlessly when we're so preoccupied that way. It's also been shown that body appreciation scores are more important and a better indicator of sexual function than just straight BMI. So you can be skinny and have a horrible opinion of your body and have terrible sexual function scores. But you can be a little plump and feel great about the skin you're in and have great sexual function scores. So that's the goal. We want to love ourselves, love where we're at, know that it's a constant striving to improve ourselves, but don't miss out. Don't put everything on hold while you're waiting for a goal to be accomplished. Enjoy the process along the way, and your partners will understand and be part of that too. Medical issues, more specifically, I work a lot with other colleagues, whether it's oncologists in a cancer survivor patient or internists if they have other problems like hypertension or something like that. We try to optimize these chronic conditions because everything affects everything. If we have a chronic medical condition, chronic inflammatory condition, for instance, it's going to affect our sexual function. And many of the medications we take or treatments we have to do to stabilize these medical problems take a toll on sexual function. And so the idea is, let's figure out if there's some way to improve it, some way to change the dose, substitute something that isn't going to be as much of a problem, or even take a little drug holiday. We kind of try to work on those issues to optimize that. Preventive screening, women always have a lot of questions about this. And the recommendations seem to change every few years. Currently, as far as GYN exams after age 65, yes, you still need to be having them, especially if you're sexually active and wanting to be sexually active. It's not all about the Pap smear. The GYN exam really just means a pelvic exam where I'm measuring the pH of your secretions. I'm looking at the health of the tissues. I'm making sure there's not prolapse. I'm checking sensation, and I'm checking the health of the pelvic floor muscles. So there's so many things working together toward your health that we really want to keep tracking that no matter what your age. Pap smears specifically, currently the guidelines are every 3 years, or if you have Pap smear plus HPV co-testing, you can do it every 5 years until age 65. And then if you've had 3 normals within 10 years, you can stop doing the Pap smears. But you still, in my opinion, should have, a routine GYN exam for good health. Mammograms up till age 55 are recommended yearly. Then it gets kind of nebulous, and it's so dependent on family history, personal history, whether your breasts are dense or whatever it is. It's individualized, but it can be every 1 to 2 years up until age 75. And then, of course, there's really no consensus at that point. It really is just a matter of individual choice with the conversation with the physician. I always like to bring out this point that even if we have physical limitations, there's often ways around it. Maybe you have sore joints, or you're not able to have such endurance as you did 10 years ago. There are special wedges and pillows and devices that help out this way. This website, liberator.com, is one I found particularly helpful with these ideas. So, think outside the box and see what there is for help when there is a limitation. It doesn't mean you have to just stop sexuality. Activity level is important, whatever we can do. The sedentary lifestyle really perpetuates problems with mood and libido. We know from research that libido and arousal do increase after even a modest increase in heart rate exercise. 30 minutes a day is a goal. Ideally, it doesn't have to be, a total knockout workout, but even just getting your body moving and functioning and heart rate up. And the key is picking an activity that you really enjoy doing and then doing that. Don't force yourself to do something you hate, because it just won't last. Sleep is so important. Of course, our needs vary person to person, but if we're feeling tired, irritable, lacking energy, and have a low libido, it probably means we're not getting enough. The impact of sleep is critical for sexual desire. Again, a study really pointed this out with showing that women with greater sleep duration have better arousal. In fact, in dealing with partnered sex, if you are able to get an extra hour of sleep, you have a 14% increased chance of wanting to have sexual activity the next day. So it really behooves a partner to provide that for the woman, if it increases your chances of the wife feeling better rested and more amenable to intimate activities, then it's worth it. Now, I could talk for a whole 3 days on hormones, and so I'm not going to get into details, but just to give a little introductory idea about, what they are and how they apply. Hormones are really chemical substances that allow the body's organs to communicate with each other, remote from all different parts of the body. They're kind of all affected by a hormone. Specifically with sex, it helps determine whether you want to engage in sex and then what you do about that. Hormones can be inhibited, hormones can be stimulated. And so it's all a matter of what's going on in your life that mediates that. But the hypothalamus, which is not in our voluntary control, plus the neocortex, which is in our voluntary control, kind of work together, feeding off of thoughts, behaviors, and the influence of hormones to create that whole complicated issue of desire. And then, as I said, this balance, we have some hormones that proliferate or activate, and other hormones that inhibit or antagonize that. And the two really need to be working in balance to have proper function. I like to compare it to this hormonal gear shift model, where we think of kind of going along in first gear. These are the estrogen and oxytocin ideas that, you know, they're important to keep us kind of functioning day to day. But if we really want to step on the gas, we need that stimulation of testosterone and dopamine to really amp things up. And then to reel it back in, we have these other things that tend to flatten it back out, so that we're not always, you know, we're not always in overdrive, and we're not always in, you know, reeling it back in mode, but we need a steady balance between these three. And then I like this quote. I mean, it kind of really sums up what estrogen does. Estrogen is the Marilyn Monroe in all of us, the hormone in the diaphanous dress, the chemical with the cleavage, the molecule with the glowing skin and ruby lips. It gives women their curves, their softness, their rounded breasts, moist, inviting vaginas. When estrogen is in power, women signal, "Take me, I'm yours." Well, that's kind of working a little bit with the testosterone effect too. I mean, it's hard to really separate, but it really, the estrogen is our most biologically active hormone. It makes us female. And so those are all the real female characteristics. Testosterone, on the other hand, even though we think of that as the men's hormone, we really need some of it too. 50% of women lose interest in sex, become more difficult to arouse, and have diminished or difficult orgasms right around that mid-40s. And by menopause, we are producing 60% less of the testosterone we produced when we were in our 20s. It's really the main hormone of libido, but it really works with energy and mood and libido too. They kind of all work together. And it's not just a matter of, I'm going to solve your libido by giving you only testosterone. You know, that would just make it way too simple. Sometimes that's all we do need. If your libido declines right around menopause and I supplement it back to a physiologic level, then great, your body's back on track. But there's so many other things that also influence desire. Like I've said, pain, emotional things, intellectual beliefs, you know, all these things can weigh on us. So we have to tease that out. I don't want to simplify it that, oh, you just need some testosterone and your troubles are solved. It can really help though. Physical clues that maybe you're low in it. You know, you used to think about having sex, but now it's been a long time since it's even crossed your mind. Pain, we have receptors in the opening of the vagina that are very loaded with testosterone or androgen receptors. And when those get low for any length of time, I've seen it happen in as little as 3 months, those areas become sore and reactive and inflamed. And one really effective treatment can be to just replenish a little bit of low dose testosterone cream right around that vaginal opening, and it can resolve that pain. So pain on initial penetration is key to that, is the big sign of that. Orgasms can just take longer or just never happen, and you think, oh, I'm tired, it's just not worth the effort. That's probably a sign you're low in testosterone. The nipples become less sensitive. Pubic hair can fall out, become more thin or patchy. Muscle mass can decline. Even bone density, testosterone can help maintain bone density. So if you have an issue with osteopenia, osteoporosis, it can be an issue there. And overall low energy, like the energy, the mood, you just don't feel like doing anything. And then if you're taking an oral estrogen or you took birth control pills in the past, this really amps up that issue of low testosterone, because with that liver metabolism, the liver produces a binding protein that binds up whatever testosterone you do have. So anyway, this is all part of my evaluation of how I help solve this. Hormone therapy is always individualized. It's not a one size fits all. And there's a jillion ways to do it. So that's why I say it bears a full conversation with your doctor as far as if it's right for you and then how you should do it, and whether you should do it global, all body symptoms improved versus just locally applied, like to the genitals for sexual activity. The bottom line for the locally applied one is, here it is with, here it is without. No pain, lots of pain. So just a little bit of localized treatment can make all the difference. And even breast cancer survivors now, there's a lot of options to help with this. Lubricants and moistures are important, and they're kind of the first line women reach for. The thing I want to make a point of here is that we have to be more choosy about what we reach for. The most common thing women do is, go down to the local drugstore and pick up, women say KY jelly, the most common brand, or Astroglide, the second most common brand I hear people say. And I'm not going to get into the complicated biochemistry of it, but there's this property called osmolality, which refers to the number of particles of solute in a solution. And when something's water-based, like a lubricant, if it has a high osmolality, it's going to pull the fluid right out of the vaginal cells and leave you feeling more sore and dehydrated and irritated. Things with a high osmolality, I mean, the vaginal osmolality of the secretions is roughly about 280 to 300. The World Health Organization has recommended that we don't put anything in our vaginas that has an osmolality higher than 380. Semen, not surprisingly, has a compatible osmolality with vaginal secretions. It's right around that same, 300, 280 to 320. But KY jelly, for instance, has an osmolality of 2,000. Astroglide has an osmolality of 8,000. So we initially put these things on and they do reduce the friction, but they might leave us feeling more dry and dehydrated, and that's the reason. So it's important to look for red flags. Propylene glycol and glycerin are two red flags that if those are in the product, it probably has a higher osmolality than you would want. I mean, most products don't publish their osmolality on the package, especially if it's high, because why would they? They're not required to. So I just like to inform people that, even these little things can make a big difference in how we function. DHEA has been known about for about the last 20 years. I've been a fan of it, prescribing it, recommending it. It got FDA approved in 2016, and it really works well because it's an inactive building block hormone. When you put it in the vagina, it melts and the vaginal cells pull it in, and then it's delicate cellular mechanisms in your cells that turn it into localized estrogen and testosterone that it needs. This is often approved by the oncologist, even in breast cancer survivors. I have a lot of colleagues I work with to really restore quality of life to these women who have been just suffering with painful, sore vaginas. And now there's, a much better option, and it doesn't have a boxed warning like estrogen does in that population. I have to say that it hasn't been officially studied in breast cancer survivors, but there's a lot of women that are successfully using it and doing well. So as time goes on, I'm sure these studies will be done. My point here is, and these are over the counter available. They're made with other soothing things like cocoa butter, beeswax, and vitamin E. So these kind of things, even just a little half put in the vagina at night 3 times a week, can make a big, big difference. Then there's Genital PRP. It's been out, the first one was done in 2011, and it's been exponentially more popular since then. It's platelet-rich plasma. And what it does is incorporates your own plasma with those healing factors that your body uses to heal you when you have a cut or an injury. Well, we harvest the blood, spin it out, get that liquid gold, and then inject it into the clitoris and the front wall of the vagina to really incorporate it with that erectile matrix. And what it does is improves and heals the sexual response with arousal and orgasm in those areas where we need it. So it's been a real breakthrough in helping women with this. Nerves and muscles can have issues. You know, low hormone can create decreased sensation because those nerves aren't quite stimulated. Testosterone, for instance, is a very potent hormone messenger to not only the nerves, but in the brain and the muscles and bones. We do tend to lose it if we don't use it often. With the vaginal muscles, things tend to constrict and get tight, and so we have to work on that to rehabilitate. The good news is the vagina is such a forgiving organ. I mean, look how it bounces back after childbirth. And so it can bounce back after having been constricted and narrowed from low hormones as well. And then the pelvic floor muscles can either be too lax or too tight. Pelvic floor health is important. Both have consequences. If the muscles are too lax, it allows everything to kind of sag and we have prolapse. If it's too tight and spasmed, we have decreased blood flow, decreased oxygen, it becomes painful and tight. And if it feels like your partner's hitting a wall with intercourse, he is, because that wall of these pelvic floor muscles is very strong and it's very tender when it's in spasm and then, you know, activated with penetration. So this needs to be reworked and can successfully be helped. Treating tone issues, we treat low tone with Kegel exercises. That's the, you know, oldest exercise ever. I want to just say that it needs to be after you've been evaluated by someone who knows what they're checking. If you have high tone, Kegel exercises are the last thing you want to be doing because you're already tight. You don't need to be making it tighter. So the key is modulation, and the goal is to be tight when you want to, be soft when you want to, and modulate between the two when you want to. Some things you might not be aware of that contribute to high tone are even high heels. If you wear high heels frequently, that tips your body's center of gravity to where you're unconsciously flexing your pelvic floor muscles too much of the time, and you could be predisposing yourself to that. We hold our bladders too long, and our muscles get used to that. So we need to empty when we feel full. We need to deal with stress, just like anything. Some people get ulcers, some people get migraines, some people, when they're stressed, it goes right to their pelvic floor and they feel tight and spasmed. So it's important to see the effects of stress on our bodies. There are a lot of pelvic relaxation techniques. And then dealing with sexual pain, I developed treatment plans individualized to really help with this. There's some good core principles with both yoga and Pilates that can help build that core and then expand that core out to your pelvic floor muscles as well. Then the big thing that I worked on with Gina Ogden was this ability to connect with your anatomy. I call it the gynecologic approach to sexuality counseling. And the way I've adapted her 4D wheel is that I put our genitals at the center of the wheel, and really the four quadrants, the spiritual, intellectual, physical, and emotional, all relate to how our experience has been, our journey has been with our genitals. And so I explore that with women, and I uncover all kinds of inhibitions and barriers through the years that have crept up and piled on in each of these areas. And then we work to acknowledge them and remove them. So it's been a breakthrough thing. I talk about it first in terms of the wheel, and then we actually go through experiencing the journey of your anatomy through looking at this digital pad. So you can see it in real time as I'm going through it. And it can be a real breakthrough experience. We have a lot of programs here at Banner University Medical Center, Phoenix, where I evaluate blood flow, and I look at sensation, and I look at pelvic floor tone. And we look at all of these things together to really make the years after menopause just as good as ever. We want to optimize health, optimize quality of life, And my goal is that there is no expiration date on any of these things. We deserve it, we can achieve it, and my goal is to help find that most optimal place for you to be. In doing that, I look at all of these things: quality of life in cancer survivors, pelvic floor health, dealing with sexual trauma. I interact with a lot of sex therapists to be part of what they're providing for their clients. And then really embracing our body image as we age. This is a poster from Gina Ogden that came from her research, her PhD research, where I just love all the little, lessons about what women really do want. And it's kind of fun to read through there. One of her books was called Women Who Love Sex. And it really was all about the reason they love sex is because what they really love is all of these things. It's not just in the sex. There's just so much more to it throughout life. And there's my contact information. If anybody wants to reach out to me, make an appointment with me. I have a passion for helping women in this part of their lives and love it. And I'm always happy to do that. So now I guess it's time for the Q&A.
Q&A. Doctor, thank you so much. This has been most interesting. I'm sure everybody has thoroughly enjoyed it. You did answer the 3 of the questions that I did have to ask you from previous people, so I won't waste your time on that. But where can one get the chart that was on slide 15? How can one get that chart?
If you Google extragenital matrix,
okay,
you'll find it. It's online. You just have to Google that. It's also in several of her books, but you don't have to buy the books. You can Google extragenital matrix, and then the image will come up. If you Google extragenital matrix images, that's where you get that chart.
Beautiful. And then there was another question, but as I said, you've also answered it. You are taking on new patients?
Yes, we are. Okay. We're starting a fellowship program because we need to train that next generation of physicians who, have a passion for helping women. And I'm just one person, and the volume is already, kind of escalating. So we have plans within the next year. We're organizing a fellowship, which is a postgraduate, like after OBGYN residency. Those physicians would then come on and spend 2 more years doing a fellowship with me to really learn all the nuances of this specific, all these specific issues. And yes, we take Medicare. We take pretty much everything.
Wonderful. So what I'm going to do now is I'm not unmuting everybody. If anybody has a question for Dr. Wickman, please unmute yourself so that we can not be interrupted. And go ahead. Anybody have a question? Don't be shy.
I have a comment. I've had, osteopenia for years and years. It went into osteoporosis. I'm on Prolia. It's gotten a little bit better. In all those years, and I'm talking 15 years, maybe even more, no one ever mentioned the word testosterone.
Well,
and you've mentioned it today, that it could be part of your bone health.
Right. I didn't mention one of the frustrations with testosterone is that as of yet, it's still not FDA approved for women. So depending on where you're living and even which doctor you're seeing, they may or may not have knowledge or comfort with prescribing it. I tend to prescribe it a lot because I read all the research on it. I'm up to date with all the meetings, all the things we know about it. And I also monitor it and prescribe it in a physiologic dose where it's safely done. But a lot of places, don't have that fund of knowledge to use. So I do interact with endocrinologists and internists who, we have some osteoporosis patients who use that as part of their regimen, but not everywhere. So I look forward to the time when we do have a FDA-approved, properly dosed, insurance-covered form of testosterone for women. I think it's just around the corner, but we don't have that yet.
So do you generally advocate that for somebody that has really bad osteoporosis? I'm just like over the line.
It just depends. I often like it as a when it's even intervening in the osteopenia state, because you're helping reel it in before it gets down the line. For you, I would have to, talk to you a little more in depth about your own personal history first to be able to say it would be a great thing to add. But, often it can just, it comes at it from a different angle than the Prolia does. And so it could be helpful, but, explore that further.
And there's a question in the chat. What lubricant would you recommend?
There's a water-based lubricant. There's some really good ones. One brand is called Good Clean Love, that they make a big point of making it isoosmolar, or compatible with the osmolality of your vaginal secretions. Another one is Aloe Cadabra. It's based in an aloe base, and that's really soothing and gentle. Sliquid has another organic isoosmolar one. Typically, the ones that are healthy tend to brag about it on their packaging, and they will tell you they do. So look for those. But they're unfortunately not usually available in Walgreens or CVS. You have to, Amazon usually carries some, or more. They're not as inexpensive as those items, but it's worth it for your body to not be causing that kind of discomfort.
What was the name of the first one you recommended?
The brand is called Good Clean Love.
Good Clean Love. Thank you. Okay. Anybody else got any questions? Well, before we say goodbye and a very big thank you, I'd like to just remind you all about Friday. Eric Ramsey from Soul String Music will be playing. He's a 2-time winner of Arizona Blues Showdown. So join us. It should be wonderful. I'm sure it will be a bit of a sing-along or a dance-along or whatever you want to do. And that should be really unbelievable. Dr. Wickman, my husband is saying he cannot find the chart you were referring to. Just say that again, please.
It's called Extragenital Matrix. What I could do is email it to you, and you can
That would be great.
To the group.
Thank you.
And that would save the hassle.
Right. Now, you got my email? Because I did email you.
You did?
I did, but it could have gone. It could have gone to spam. It's Bobba, BOBBA, Pinky, PINKI, one word, @gmail.com.
Okay. I'll send that over to you so you can distribute it.
That's wonderful. Thank you.
Yeah, it is a helpful tool.
Thank you. Thank you.
May I?
Sure. Please do. Who are you? Come.
Chu.
Hi, Chu.
Oh.
Hi. Susan to Dr. Wickman.
Yes, I know.
But Dr. Wickman, do you have like a long list of people getting the O shot, and is there any age limit, or as far as youth or like whether they're young or old, is there any age limit to that? And
Yeah. I have a lot of women getting that. We ran a little special on it in August and did like 25 just that month.
Right.
But there is no age limit. The oldest person I've done was 80, and men can have it too. The little injections of PRP in the penis can help with erections and that response. But the main thing is that you have to just try to make your plasma as healthy as it could be for the month leading up to it, and try to avoid taking aspirin or Advil, anything that can affect your platelets. And then afterward too. But
As
yeah,
far as,
there's,
oh, I'm sorry.
no, that's okay.
Would you mind talking about like the pain? Is there any pain and, stuff like that?
No, there's no pain. We make sure to, I put some little numbing cream on the area first, and then we put a little bit of ice right before, and then I even do a little injectable anesthetic to make sure that there's no discomfort involved.
Right.
Because it makes everybody cringe when you think of a little shot going into those tender spots. But really there is no discomfort, and then after the numbing wears off, there's no downtime or problems there.
Thank you.
Oh,
Thank you.
Um,
Thank you.
may
Anybody else?
May I say something to Dr. Wickman? I just wanted to say on behalf of Rabbi Levi and his wonderful wife, Connie, and everyone in the SOS community, we can't thank you enough for being here, accepting to be a presenter graciously. I'm sorry if I'm doing this instead of the moderator. I feel like obligated to say this with pleasure, of course, because I invited her and she did not even hesitate to.
Well, thank you, Chu. We really appreciate it. I know that you were the instigator behind this, and we all thank you so much for bringing Dr. Wickman to us. Thank you.
Well, I have a passion for talking about this topic, and if it just helps even one person, then I'm all about doing it. So thank you for letting me.
Thank you very much indeed. You stay safe and well, and everybody stay well and safe, and have a lovely 6th night of Hanukkah. And does anybody want to stay on and schmooze? We can, otherwise we can all say goodbye.